when we talk of prevention of HIV, what are we talking about? How you can prevent it, or how you can try as much as possible to avoid getting HIV, and what are the ways you can do to prevent HIV. It includes abstinence. Abstinence means by not having sexual intercourse with an infected person or any other thing. That is number one thing you can do, by you totally abstaining. If you are not ready, or if you are not sure of the person you are coming to have intercourse with, just abstain. And also, never sharing needles or sharp instrument So you can avoid using injection needles. Don't inject yourself, or let a health personnel inject you with a needle, and also inject someone with it. If the person is infected, you can acquire the diseases. And also sharp-edged instruments, that includes blade or knife or any other thing. If you cut someone and you are not sure of it, and you don't even know, and you also use it and it cuts you, you might transfer the virus into your system. Also, by using condom the right way, you have to know that you read the process, how it's being used. You don't tear it, you don't use pin to prick it or any other thing, so that you will not have leakage or anything that might transfer the virus into your system sexually. Also, by staying faithful to one partner. If you know the HIV status of your partner and you are aware that he or she is not having HIV, you must ensure that you don't become promiscuous or have multiple partners. At the end of the day, if the person you are coming to have affair with is not properly in line, or is having HIV/AIDS, you might acquire it sexually, and it will harm your system, and it might lead you to where you don't want to be. Also, as health personnel, or anyone, not necessarily health personnel, but anyone who are at risk of getting HIV, you can ensure by taking pre-exposure prophylaxis, that is PEP, and also post-exposure prophylaxis. When you know that you are going to be involved in something, you are not sure of yourself, not necessarily sexually, but an activity that you are not sure, you think you might be exposed to HIV, you need to ensure that you take your post and pre-exposure prophylaxis. Complications of HIV, and when we talk of complications, what am I trying to mean? I'm trying to mean when someone has HIV and doesn't take it serious, or is not well treated, what it leads to, the complications that it leads to. And some of the complications that it leads to include tuberculosis. Some of the complications that it leads to also include pneumocystis, pneumonia, infection that causes inflammation of the lungs. Fluid builds up in the lungs, so it leads to inflammation. And also we talk about cryptococcus, that is cryptococcal meningitis. Meningitis that occur as a result of fluid building up in the lungs that is infected and is spread through from the lung to the brain. So that is cryptococcal meningitis. And it also leads to opportunistic infections. Opportunistic infections, what am I trying to mean? Some of the infections may occur severally and severe in the person's body system. Because the person's system is weak, almost all the time, the person may attract any infection that the person will happen to acquire or get into contact with. And when the person acquires the infection too, unlike any normal person who is not having HIV, will be healed or be treated simply. In the situation of a person with HIV, it's not like that. It takes a long while, or it takes time before it's treated. I'm coming to teach you how you can do self-test on HIV. And first of all, you can go to any nearby pharmacy and you will tell the pharmacist that you need HIV test kit or first response. First response, it comes in a lot of brands. This is the brand I got for myself. And also you will need buffer solution for HIV. Most of the times it doesn't come with the test kits, so it will be better you do it in a pharmacy. But if you can buy the buffer solution too, why not? You can buy and you follow this process I'm about to teach you so that you do. So I have my buffer solution here. I have my pricker that I will use to prick myself, and I have my alcohol swab. Okay, so here it goes. Okay, so you open your test kit like this. When you open, that's how it is. First response. So you open like this, then after you open your alcohol swab, and you will clean the hand. You will prick, so you can see I'm cleaning my hand. After you ensure you open your pricker, then you prick yourself with it. And after you ensure you squeeze out the blood to come. I unfortunately don't have the collector here, so I want to drop it on it directly here. Then you pour your buffer solution on it, just 2 drops, 1, 2, just 2 drops of the buffer solution on it, and you wait for a while for the test to read. You wait for a while for the test to read. Okay, so our result is in, and as you can see, the line was just 1 negative. If the line came 1, it would have been a symbol telling me that maybe the virus is now in my system. Or if it came 2, it would have confirmed to me that I have it so much in my system. But since the line just drew 1, it just drew only 1, it means it's negative. Yeah, so when you also do it at home, ensure it reads this way. Thank you. Okay, so let's talk about treatment for HIV. When someone acquires HIV, what are the treatments? Currently, as I speak to you, there is no treatment for HIV. World Health Organization hasn't been able to find the actual treatment for HIV. But that doesn't mean when you acquire HIV, that's the end of life for you. They have been able to develop antiretroviral medications that they manage people who have acquired HIV on it. Yeah, and I wouldn't want to mention some of the names HIV medications to you so that someone might abuse it, because I said some signs and symptoms, and so when the person is feeling that, they'll think like, let me go to the pharmacy to get this thing. No, it's not done that way. It's not the fact that I said those signs and symptoms mean the moment you have it, you've totally gotten HIV. No, it can be a different sickness. So you have to first of all ensure you've gone to the hospital to check. So I wouldn't mention some of the medications to you, but in case you are feeling all the signs and symptoms I told you previously in my teaching, you have to ensure that you first of all test by yourself, or you've gone to the pharmacy or the hospital to check it. And also when it's confirmed you have, they themselves will manage you. And trust me, unlike in the olden days when someone has HIV, everyone begins to fear. These days it's not like that. We manage you on antiretroviral medications, and we also advise you and encourage you to eat healthy, well balanced diet, a lot of fruits, a lot of vegetable, you exercising, you avoiding stress, and a whole lot. And trust me, you will stay longer if you abide by the rules and regulation, the precautionary measures, and also the medication. Ensure that when you don't have HIV, you don't stay loose so that you have. And please, those who have it, or who are staying with partners who also have it, and you are aware that you have it, your partner is also having, please and please do not spread it also. Please stay faithful to your partner so that you don't transfer it to innocent people. Share love, think about others, let's save the world. Thank you for your time. Thank you for getting time to listen to this my teaching. My name is Renewal Nyami. You can follow me on all social media platforms and subscribe to my page for more health topics. Love you. Thank you.